breast cancer, you think of women in their upper 50s, which is partially true because that's the most common age group to get breast cancer, but men and women can both get breast cancer. And you don't have to be over the age of 50, usually you have to be over the age of 20, because when teenagers, they don't have the correct amount of hormones. I chose to do breast cancer for my topic because my mom had breast cancer last year and I was more interested in learning about this. Today I will inform you about different types, treatments, and treatment side effects. Breast cancer is divided into 4 different types: non-invasive, invasive, recurrent, and metastatic. Non-invasive means it doesn't spread into the surrounding tissues, and one type of that is ductal carcinoma in situ, and that means that it stays in the original place where it's at. And ductal carcinoma can also be invasive, which means that it spreads into the surrounding tissues and lymph tissues. Recurrent is any type of breast cancer that comes back after the initial treatment, and it can come back within a couple of days or weeks or years or any time. A type of that could be triple negative breast cancer, which means it's negative for estrogen, progesterone, and HER hormones, which usually are what cause breast cancer. So this is the type that men can get too because it doesn't need the estrogen. And the last type is metastatic, which means that it spreads into other areas of the body, such as your bones or your brain. The treatments for breast cancer, most types of cancer, are chemotherapy, radiation, or surgery. The types of surgery for this are lumpectomy, which means you just remove the tumor and any surrounding tissue that could be affected. And mastectomy means you remove the whole breast, and you can have simple or total. And in simple, they don't remove the lymph nodes, but in total you do. And chemotherapy is when they put chemicals into your veins through IV or ports, and ports are put in for most people because they don't have to find the vein every time then. And radiation was they have radio waves directly to the spot, and that causes sunburn usually. Well, not exactly, but it looks like sunburn and makes your skin get red. And some other side effects are neuropathy, which is nerve pain, and shingles, which looks like a rash, but it's also a nerve caused thing. And a low immune system, so you can get any common cold. Anemia, which it could be iron deficiency, or pernicious, which is lack of B12, and you can take pills or shots to help that. Anxiety and joint and bone pain, and also blood clots, which can be very serious if they're in your lungs or your brain. But they can be other places like your legs and your arms, which just cause a lot of pain. And also flu-like symptoms, so like coughing and being really tired all the time. That happens a lot. So I informed you about the treatments and the treatment side effects and different types. Are there any questions? Thank you for listening to my speech.